It is my personal mission in life to make sure dancers know that popping and catching in their hips is not a normal sensation, and that there is, in fact, a lot that we can do to correct that symptom and make sure that it doesn't lead to an injury further down the line that is much more serious. Hey everybody, and welcome back to the Unchoereographed podcast. I am your host, Dr. Jenna Lower. I'm a physical therapist and dance medicine specialist and the owner of On Point Wellness and Rehab here in Virginia. Today, we are going to be talking about probably my favorite thing to talk about ever and treat is hip impingement and labral tears. This is something that is so common in the dancers that I see and in the general population, and I specialize in this area, helping people get rid of their hip pain, whether it be impingement, labral tears, or something else conservatively without having to go through surgery. So I'm super passionate about this. I'm really excited to have this conversation with you guys today. And what we're going to be covering and talking about is 5 common symptoms that you may have hip impingement. I think it can be kind of a hard thing to understand. What am I feeling in my hip? Is what I'm feeling normal? Is it something that I need to get looked at? Do I need to go to a doctor? Do I need to go to a physical therapist? So getting a better grasp on what is a normal thing to feel in your hip, I think is really, really important. Most of my dancers that come in to see me have no idea that what they're feeling isn't actually normal. They think that, well, every dancer's hips do that. Every dancer's hips pop or are painful. And the reality is what they're feeling is not normal. It might be common, but it certainly isn't something that we want to be seeing in the hips. And it potentially is a sign of a bigger issue or potential injury risk down the line. So I think it's really important to understand what is considered normal versus more of a red flag. So diving right in, the first symptom of hip impingement that we're going to talk about is something called the C sign. The C sign basically explains where the location of your pain is. And so if you were to take your hand and make a C shape and kind of wrap that right around the outside part of your hip so that like your thumb is on the front hip bone and then your fingers are kind of wrapped around to the backside, many patients that are experiencing hip impingement, that is exactly where they describe their pain. They kind of cup their hand, put it right around the side, and they say it's kind of right in here. So we call it the C sign accordingly. Now, there's a reason that we sort of feel pain in those areas when we have either hip impingement or a labral tear. And it's because it's not just the front side of the hip that's involved. Often this is where you'll feel some of the other sensations like clicking or popping, or maybe where a majority of your pain is. However, there's involvement of the entire hip joint, and mechanics of the entire hip joint are at play here. So on the front part, that's where your hip flexor is. That's often the piece that's actually getting impinged or caught, or there's excessive friction there. So we start to get some inflammation, maybe some tendinitis in that area. But that's where a lot of the irritation will stem. However, much of the reason that we feel the pain on the front is because there's actually a problem on the back side of the joint. So where our deep hip stabilizers and rotators are located is more on the outside the back side of the hip. And there's also usually a problem in those muscles, which is leading to excessive compression and friction on the front side of the joint. So it is really important that we are paying attention to kind of the front and the back side. And that's often why people will explain their pain in that pattern. There often is pain on the lateral, the outside portion of the hip as well, which is where your glute med tendon attaches. And there often is some involvement in that muscle, whether it be a weakness there, a problem with stability, maybe there's excessive tension through those muscles. And so in general, these are kind of all the common areas that we will see be symptomatic with somebody that has either hip impingement or a labral tear. We're not going to dive too much into how to treat all of these different things. We're going to save that for another podcast. For the purpose of this, we're just going to kind of talk about like the common symptoms. So number 1 is that C sign. The next thing that is a symptom that is not considered normal, it's more of a red flag symptom, is that you're feeling a popping or a catching sensation specifically every time you flex your hip or bring your knee closer to your chest. Now, this can happen with day-to-day activities, so it might be walking around that you feel it. It might be going up and down stairs. It might be every time you flex your hip to sit down in a chair. But it will be like a pop. People will describe it as a pop, a catch, a snap. All these different words kind of, you'll commonly hear patients and dancers describe it as. You might be feeling those symptoms when maybe day to day is okay, but then there's also what happens when I'm dancing. So the flexion movements that would commonly bring on these symptoms would be something like a pliés or a développé. Développé is one of the biggest complaints that I get with my dancers, is that there's a popping every time they lift and lower their leg in any sort of extension. And then alongside that might be happening when you're doing fouette turns or if you're leaping or jumping. But in general, the movement often will, the pain or the catching, snapping will mostly be reproduced with any sort of flexion type movement. You also might feel it if you cross midline with your leg. So if you bring your knee sort of across your body, that also brings us closer towards the impingement position of the hip. So that often will also bring it on, even more so if you're already in a flexed position. And so that catching and popping can be really, really irritable. Sometimes it's not painful. There's just an audible noise or you can feel it. Sometimes there is a good amount of pain that's associated with it. Just know that popping and catching in the hip isn't a normal sensation. And even if it's not painful right now, we want to make sure that down the line, it doesn't turn into a problem or an injury, because it could be a sign. Usually it's a sign that the mechanics are off, that we are not moving maybe with the correct muscle patterns, or we're not strong in an area where we should be. We're not stabilizing, lots of different reasons, but the mechanics are off. And if you keep letting it pop and catch, there's a lot of friction that comes along with that, which generates some inflammation and can create problems down the line with pain, things like a tendonitis or an overuse problem, and even all the way up to having a full-blown labral tear. So it's really something that we want to pay attention to. It is my personal mission in life to make sure dancers know that popping and catching in their hips is not a normal sensation, and that there is, in fact, a lot that we can do to correct that symptom and make sure that it doesn't lead to an injury further down the line that is much more serious. The next thing, okay, so symptom 1 was the C sign. Symptom 2 is popping and catching that happens with mainly hip flexion. The third is limited range of motion into particularly a squat. So if we try to squat down, it might be a grand plié for my dancers. The range of motion is very restricted. Like you almost feel like you can't get any lower. You kind of get stuck. And with that, there very often is, again, the sensation of a pinching or catching. Sometimes there won't be the symptom or there won't be pain with it. It will just feel like I can't go any further. Often the reason that there's no pain associated is because people will stop themselves from going further because it hurts. So sometimes I'll have my dancers, if they stop short and I'm like, okay, go deeper. Let me see what happens when you actually go full range. And then they're like, oh yeah, that hurts. So this is a really, really common occurrence with both hip pain and labral tears that we see. You can't get into that deep squat. And it's a big problem because we need to squat a lot throughout our day. Basically, every time we get up and down from a chair, or on and off the toilet, or in and out of the car, that's a squatting motion. Picking something up off the ground, doing our grand pliés in class, jumping. There's a lot of squats that we do throughout a day. So you may think, well, I'm a dancer, I don't squat for exercise, but it's a very functional movement that we need to be able to do. So if you think about, if you have symptoms every single time you go into a squat, and it's creating a little bit of irritation, and then you think about how many times you do that throughout a day, well, of course you end up with irritation, inflammation, pain, all of these things that come alongside hip impingement. And these symptoms occur because of just the sheer repetition that happens throughout the day. And so that squatting motion in particular is one that I see almost every single person that walks into the clinic that complains of or has hip impingement complains of pain or difficulty getting into a squat motion. Now, again, the good news is there is a whole lot that you can do to correct the mechanics to be able to get into a squat. In fact, most of the time when my patients and my dancers come in, I assess their squat and then I check a few other things. I kind of see what their range of motion is with hip flexion. And generally by the end of that session, session 1, we can get them full depth squatting again with minimal to no pain. If we can do that, if we can make that happen, that is usually my sign that, okay, we can definitely treat this conservatively because we're able to manipulate the mechanics of how you do certain things and it takes your pain away. That's a really good sign that this isn't something that we're wanting to jump into surgery. We definitely want to treat this conservatively and just work on improving those mechanics and those movement patterns so that now you can do things like squat and there really are no symptoms. So there's a lot that can be done for that, but just know it is one of the main symptoms that is not normal in your hip. So if you're feeling that, be sure to get it checked out. Okay, so the fourth one. This one is often surprising for a lot of people, but generally prolonged sitting will actually bring it on. And I think a lot of people feel like, well, it normally hurts when I'm moving and like doing stuff, right? Like when I'm doing a développé or I'm jumping or whatever, that's when the pain is. So why does it also hurt when I'm sitting still for long periods of time? Shouldn't it feel better then? And the answer is it's because of the position that your hip is when you're in a seated position. Specifically, when you're in a sort of relaxed, reclined seated position. So the times that people tend to complain about it the most are when they are sitting in the car, because it's kind of that bucket reclined seat. So it sort of puts you into that tilted position. And then also when you're lounging and relaxing on the couch, which again can be really frustrating because you're thinking, well, I'm just going to rest and relax, but then it actually makes it worse and hurt more. So again, when we're in this sort of like relaxed seated position, what happens is our pelvis goes into a posterior pelvic tilt. So it kind of tucks under, our tailbone kind of tucks under a little bit. And the problem with that is it creates a bit of a forward or an anterior glide motion in the hip joint itself. So the head of the femur actually gets pressed a little bit further forward in the socket. And now there is compression on the front side or excessive stress on the front side, which reproduces the symptoms of the hip impingement. Because the impingement, again, generally will happen on the anterior side of the joint. So it puts you into that posterior tilt, the head of the femur glides forward, it puts more compression into those already irritated tissues on the front side of the joint, and we end up with more pain and possibly, more of those symptoms. When you stand up, it might feel like it catches or pinches as well. Movement, so it's kind of a balance between I need to move for this to feel better, but then I don't want to do so much that it becomes irritated from overuse either. So it can be a really, really tricky balance with impingement, and it can be really hard as the person experiencing the pain to figure out what the heck is making this worse. It hurts when I sit too long, but it hurts when I'm up and walking and moving and exercising. How do I get out of pain? How do I find a position of comfort? And again, the answer is there's a whole lot that we can do for that, but you need to get your hip assessed to figure out, well, mechanically, what is happening for you, because it's not the same for every single person, but then learning strategies of how to hold proper mechanics in the joint first, how to move properly first, how to reduce some of the inflammation that you're experiencing, and then strengthen all the good patterns that we want that will help long term. So again, lots that can be done there, but if you are experiencing pain with sitting for prolonged periods of time, that is not considered a normal thing and would be more of a red flag symptom that impingement may be one of your problems. Okay, so really quick recap. Symptom 1 was the C sign, so the location of pain. Symptom 2 is catching or popping, clicking sensation with any sort of flexion. Symptom 3 was pain or limited range of motion going into your squatting motions. And then symptom 4 was pain with prolonged sitting, which brings us to our 5th symptom, which is the constant feeling of being tight, but then when you try to stretch, it either doesn't help or it makes things worse. This again is something I think most people, when they have pain anywhere, the first reaction is, well, I better stretch it. My hip hurts, I better stretch it. My hip flexor hurts, I'm going to do hip flexor stretches till the cows come home. And then I either do it and now I'm in more pain, or I do it and I have very, very limited or minimal relief. It's very short-term relief. And the reason is stretching does not actually correct hip impingement. In fact, it can make it worse because of the position that you have to put your hip joint in. It sometimes puts more pressure on those structures that are already very irritable. So in general, when somebody comes in with what we suspect is hip impingement, the first thing that I tell them to do is to stop stretching, and we don't start there. I very rarely give stretches to a dancer or a patient who has hip impingement early on. Later on, we may bring those things back in once the tissues are no longer irritated or once the dancer has learned how to move properly. But right off the bat, that position tends to irritate things more, and so we try to avoid it. The other thing is, a lot of the reason that you feel tight and that you constantly want to stretch is because there's actually an underlying problem with stability or strength. And so our body, it craves stability. It craves feeling like it's like that joint is in a nice stable position. But when we don't have the strength and stability to actually do it, it sort of gives us, the reaction is, well, our body's like, I'm gonna tense all those muscles up to give me sort of a false sense of protection. And it's kind of like tricking our body into feeling like, oh yes, this joint is very stable. But it's not the most effective use of muscle contraction. So instead, now you've got all this muscle tension that leaves you feeling extremely tight and restricted. But the reason that it's tight and restricted is because of the underlying strength or stability issue. So it's really, really important that we identify what is the root cause of this chronic feeling of tightness. And in hip impingement, it often is not that the muscle is actually too short and needs to be stretched. It's often that you need to strengthen and stabilize the appropriate muscles so that the mechanics can be restored. Or we need to work just on the mechanics of like how you're moving your joint. Maybe the strength is okay, but you're not moving in the proper pattern. So the root cause is everything. And in general, people with hip impingement, stretching does not solve the problem. It very often makes it worse. And it is really, I would say, one of the worst things that you can do for it when you're in a very irritable state, because it only re-irritates the tissues more. And so we want to find other ways of getting rid of your symptoms and that don't involve stretching, but maybe involve more movement correction and stability training. So again, full list of the 5 things that we went through: the C sign, pinching, popping, catching in hip flexion, limited range of motion or pain pinching with squatting, pain with prolonged sitting, and always this like chronic feeling of tightness or potentially stretching that makes it feel worse. So those are the 5 symptoms that I would say are most common but not considered normal. So if you're a dancer out there and you're experiencing any of these symptoms, right? It may not be all of these. It may just be a few of these things that you're feeling or one of these things. Please know that these are not normal things to feel. Sometimes we have it in our heads that, well, again, every dancer feels popping when they do a développé, but that does not mean that it is normal and it's good for your hip. So if you're experiencing any of these symptoms, I would strongly urge you to get them looked at, get checked out by a physical therapist, one that understands hip impingement and specializes in it, but also one that works with dancers, somebody that understands the mechanics of what you need to do on a day-to-day basis every time you step into the studio. Because if you don't understand that, you can't correct the movement patterns that you are needing to do. So get these things looked at sooner rather than later. Hip impingement is something that can progress if not dealt with. It's not just going to go away. It can progress into a lot of irritation and inflammation, which is very like a chronic condition that it's kind of hard to get rid of once it turns chronic. And also, even worse, it can progress towards something like a labral tear, which is a lot harder to correct. It can be corrected without surgery, but it's a lot harder to deal with further down the line rather than when you first start to experience these symptoms. So please make sure that you are reaching out. I will put a link to you guys. I always recommend Doctors for Dancers to find a dance specialist in your area, or please comment below and reach out to me directly. And I have lots of online resources to help you guys if you are not local to me, that you still need a little bit more information about how you can actually correct this. We've got lots of free workshops and all kinds of things. I will link resources for those below, but please reach out anytime you need it. If there's one takeaway from today, I want you to understand that these symptoms are not normal. They are things that need to get looked at, and please know your body and listen to your body and be your own advocate to get help versus just taking the excuse that, oh, this is a normal thing that all dancers feel. Please, I want you to feel empowered that there is something that can be done for this, and get help before it turns into something much worse than it currently is. So thank you guys so much for joining me today on this episode of Unchoreographed. I hope that you learned something and got something out of this. If you want to hear more about hip impingement and the hips, leave me a comment or a review. I would love to connect with you on a more regular basis and create more of the content that you guys feel is helpful. So please let me know what you want to hear more of, what your questions are, and we'll keep the conversation going. And until next time, I will see you guys next week on Unchoreographed.